Everyone, and welcome to today's session on Sushruta Samhita Adhyayana. Without any delay, I would like to call upon Dr. Muridhar Sharma Sir, Professor Emeritus, STMC Udupi, to take over the session. Welcome to you, sir.
Next is अथात शोषप्रतिषेधं व्याख्यास्यामः यथोवाचगुणवन्दनन्तरिः अनेकरोगानुगतो बहुरोगपुरोगमः दुर्विज्ञेयः दुर्निवारः शोषो व्याधिः महाबलः शोष or cachetic disorder is a complication of many diseases, or it also can induce many diseases by itself, and it's most difficult to diagnose and understand. It's one of the most difficult thing to be understanding, like why the cachetic disorders do occur. And Durnivaraha, it's difficult to prevent, and treatment also is quite difficult, and it's a very this crucial disease, a potent disease rather. संशोषणात् रसादीनां शोषः इत्यभिधीयते क्रियाक्षरे कर्त्वाचाक्षरः इत्युच्यते पुनः राजश्चन्द्रमसो यस्मात् अभूत् एषः किलामयः तस्मात् तं राजयक्ष्मीति केचिदाहुः पुनर्जनाः सव्यस्थैः जायते दोषैः इति केचित् वदन्ति. Now, because it affects the assimilation of all the dhatus, rasadi dhatus, it's called as shosha. And because it reduces the vitality of the person, it's also called as kshaya. And because of historical the story, epical story, like because of the curse over the moon, Chandra, he had that disease, and that's why it's called as Rajakshma. Now, many times the Rajakshma is translated as tuberculosis, but that's not really correct. Say, tuberculosis also can result in the Rajakshma, a Shosha, and Shosha is a better word for, or cachexia is a better word for Shosha. Any condition where there is a weight loss that is considered to be Shosha, and Rajakshma also can be, tuberculosis also can be a cause for the Shosha, and there are multiple other causes which will come to that, and hence equating Shosha or Rajakshma to tuberculosis is not justified. Savyastaihi jayate doshaihi iti kechit vadantihi. It can occur due to single doshas or all the doshas, multiple doshas according to some. But according to Sushruta, ekadashanam ekasmin sanidhyat tantre ittilah क्रियाणाम् अविभागेन प्राग् एक उत्पादनेन च एक एव मतः शोषः सन्निपातात्मको ह्यतः, because it presents with a similar single presentation of weight loss and progressive debility, and because the general plan of the treatment in any category disorder is the same, it has to be considered as a single and a tridoshaja. That's what Sushruta says. Now, cachexia is a relatively older term. The present term, and particularly in pediatric conditions used, is a failure to thrive, is the current term used. And the pathophysiology is cachexia is characterized by weight loss involving depletion of host adipose tissue and skeletal muscle mass. When there is a reduction of the skeletal mass, this muscle mass and adipose tissue, and progressive weight loss, continuous weight loss, that condition is called as a cachexia or failure to thrive, or the other definitions or other words used are weight faltering growth, or growth deficit. Now, in general, it can be, the causes can be classified into increased metabolic rate and energy expenditure, as in case of either hyperthyroidism or even abnormality of the adrenal mechanisms, where there could be a rapid metabolic activity in the body, and hence the energy used is energy spent in the body is more than the what can be supplied, and hence it can result in the cachexia. Or it could be reduced nutrient intake or availability. If it is consumption of the food or the calories is less than optimum, either it could be like in certain diseases the patient is not able to consume, like a patient who is unconscious and fed on rails tube, or a patient who has some other disease conditions where it can occur, it cannot result in the consumption. Or if it is not available, as in case of poverty, conditions where the food is not available in property, or increased breakdown of muscles. Breakdown of muscles can occur either due to injury or due to excess of stress. And then there is one more condition called as the cancer-induced cachexia or cancer cachexia in diseases like cancer, where there would be tumor necrotic factors as well as interleukins which are secreted in the body. They may produce the destruction of the muscle tissue, and that itself can be a cause for the cachexia. Or prevention of the muscle growth. If there is an abnormality of the growth of the muscles, that also can be a cause for that. Then another term which is very close to cachexia is a protein energy malnutrition. The difference between protein energy malnutrition and the cachexia is cachexia defines only about the weight loss phenomena, whereas protein energy malnutrition is defined as a cellular imbalance between the supply of nutrients and energy in the body and demand for them to ensure growth, maintenance and specific functions. That is a rather, I would consider, variant of a Shosha. When we consider Shosha Vyadhi, protein energy malnutrition also is a part of it. Though weight loss is not the only factor in case of PM or protein energy malnourishment or marasmus, that condition. So even that could be considered as a Shosha. The causes which can produce these cachexia are the chronic conditions like HIV, AIDS, chronic obstructive pulmonary disorders, congenital heart failure, kidney diseases, so on, can trigger cachexia. Inflammatory conditions like rheumatoid pathology, inflammatory bowel disease like ulcerative colitis also can contribute to cachexia. Cancer cachexia is a very specific condition where the cancer cells produce many of these necrotic substances which can produce the cachexia. Metabolic changes, altered metabolism due to disease process also can result in cachexia, and muscle and fat tissue pathologies can occur. Of course, reduced food intake also can be a cause for the cachexia as such. Now, the clinical signs are udrekat tatra lingani doshanam nipadantihi. Because of the prominence of the doshas, the clinical symptoms of vata pitta kapha can occur present as such in the clinical presentation. क्षयात् वेगप्रतिघातात् आघातात् विषमाशनात् जायते कुपिते दोषैः व्याप्तदेहस्य देहिनः. It can occur due to doshakshaya or vegapratighata due to an obstruction to the passage of the doshas as such. Aghatat due to the trauma. Vishamashanat improper dietary intake. Almost the same as we now have discussed. That is exactly the same thing which is described by Shosha as the different causes of the Shosha. Kapha pradhanehi doshehi ruddheshu rasavatmasu. One quite important is because there is a prominence of the kapha, and kapha produces an obstruction to the passage of the doshas, and hence it can result in Shosha. Or the other causes are ativayayino vapi kshine rejasi anantaram kshiyante dasavasarve tada shushyati manavaha. Because of excess of sexual activity, the shukra dhatu becomes weaker, or the total ability of the shukra dhatu is reduced, which results in a progressive this reduction of the other dhatus, or retrograde reduction of the other dhatus. That also can produce the Shosha. Now, from the current contemporary science point of view, this kind of a phenomena is not really understood properly, whether this is possible or not. That kind of a phenomena is not really understood. But over sexual activity in excess, can result in the other many complications which later on result in cachexia, though it may not be exactly in the pattern like there will be a step-by-step reduction of the dhatus. Anyway, that's one of the unique concept of Ayurveda, where that Shukra Kshaya, Pratiloma Kshaya is one of the possible issues or unique issues mentioned by Ayurveda. Anuloma Kshaya, like where this initial blockage or initial reduction of the nourishment from the gastrointestinal tract leading to the involvement of the other tissues. That's well known, that is proved by the current physiological point of view, like when you the conditions where the food intake is reduced and results in the cachexia. That's quite obviously the issue. But Pratiloma Kshaya is a unique concept of Ayurveda. भक्तद्वेषः, ज्वरः, श्वासः, कासः, शोणितदर्शनं, स्वरभेदश्च जायेते षट्रूपे राजेक्ष्मै. The main 6 varieties of the clinical symptoms of Rajayakshma are anorexia, fever, cough, breathlessness, or even hemoptysis, swarabhedah, that's hoarseness of the voice. Now, majority of these symptoms also could be seen in tuberculosis, but not simply the tuberculosis. Many other chronic pulmonary conditions like bronchiectasis, tumors of the lung also can present with the similar clinical presentation. So, I would not limit the Rajayakshma work to only tuberculosis. Tuberculosis, of course, is a Rajayakshma, no doubt about that. स्वरभेदः अनिलात् शूलं संलोचश्च अंशपार्श्वयोः ज्वरो दाहो अतिसारश्च पित्तात् रक्तस्य च आगमः शिरसः परिपूर्णत्वम् अभक्तच्छन्दे एव च कासः कण्ठस्य च उद्ध्वंसो विज्ञेयः कफकोपदः. Now these clinical symptoms which are presented also could be related to the aggravation or prominence of the doshas. Because the vata becomes more prominent, the clinical symptoms like hoarseness of the voice or atrophy of the shoulder muscles, shoulder area, shoulder blade muscles or shoulder cuff muscles becoming atrophied, they are the complications of vataja shosha. Whereas pitta lakshana would be jvara and burning sensation, or even diarrhea, or even hematemesis, could be hemoptysis or hematemesis also could be the complications of the pitta. Due to the visheshan of the kapha, there could be a feeling of fullness, that heaviness in the head, and anorexia could be the kapha. So all the 3 dosha lakshanas also can occur. Ekadashabhi ebirva shadbirvapi samanitam kasa atisara पार्श्वार्थी स्वरभेद अरुचिज्वरैः त्रिभिर्वा पीडितं लिङ्गैः ज्वरकास असृगामैः जक्ष्यात् शोषार्पितं जन्तुम् इच्छन् सुविपुलं यशः. Now the differentiation between that 11 prominent symptoms, ekadasha lakshana or shad lakshana or 3 lakshana. 3 lakshanas mainly the kasa, jvara, kasa and asraga, like the hematemesis. Any of these, they do not make much difference. Whether you enumerate 11 signs or 6 signs or 3 signs do not make much difference. All of them, they suggest about a poor prognosis, and the treatment would be quite difficult. Vyabhaya shokasthavirya vyayama adva upavasadah vrana varakshara pidabhyam shoshan anye vadantihi. Now, in addition to these doshas initiated in the body, the triggering of dosha can occur due to either excess of sexual activity or emotional disturbances, shokastha, psychological disturbances, and sthavirya, old age itself, degenerative, progressive degeneration due to the old age, or excess of exercise, or excess of physical activity like walking, or upavasa, lack of food, vrana, a chronic wound, and urakshata, where there will be abnormality of the respiratory tract. Chronic respiratory pathologies also can produce shosha, so atrophy can produce, cachexia can be produced due to other causes also. The clinical symptoms of these would be vyavaya shoshi shukrasya shailingai upadrutaha pandudeho yatha puram kshiyante chasya dhatavaha. In vyavaya shoshi, or that pratilomakshaya produced due to shukra, the patient would have all the lakshanas of shukrakshaya, shukrechira prasakyeta shukram shonitameva, the clinical symptoms of improper secretion of the semen, and the maybe the blood mixed semen. Along with that, pandudeha, patient would be pale, and there would be a retrogressive abnormality of the dhatus. Now, of course, as I told you earlier, it's again the same thing. To prove or present exactly the same issue based upon the current physiology may not be possible, because current physiology has not really understood or has not really given due importance to this aspect of the disease. But practically it may be seen in many of the patients, it can be seen, and many times we attribute it to the sexually transmitted disorders like HIV and so on. So issue is bit complex, like whether it can be proved or not proved, and not proving this is not a drawback also, that's the other way. Anyway, that's one part. Then pradhyanashīlaha srastangaha shokashoshapi tādrishah vina shukrakshayakritihi vikarihi abhirakshitaha. A patient developing catectic disorder to psychological disturbances also would have a similar clinical symptoms, but along with that he would be introverted. Pradhyanashīlaha is introvert behavior. His behavior will be of a sort of depression, and his physical activity also would be affected. That is the evidence of shokashosha or shosha cachexia produced due to psychological disturbances. Jarashoshi कृशः मंदवीर्य बुद्धि बलेन्द्रियः कंपनो अरुचिमान् भिन्न कांस्य पात्र हतस्वरः श्रीपति श्लेष्मनाहीनं गौरव अरुचिपीडितः संप्रस्कृत आस्य नासाक्षः सुप्तरूक्ष क्षमलच्छविः. A Jarashoshi, degenerative disease, old age or senile cachexia, patient would be physically weak and his vitality would be lesser, and intellectual capacity also would be lesser, physical strength would be lesser, and he tends to have tremors, and anorexia or dyspepsia would be the other feature. His voice quality would be like a broken vessel produced sound, and he spits out only watery contents. There will not be much mucus in the spit out, and the patient would have a heaviness in the body. Anorexia would be the other feature. He tends to have more discharges from the nose or mouth, and his fecal material and throughout the body a dryness would be seen. Now that's a senile pathology where you will see the degenerative changes in all the tissues. That's exactly the clinical features which you see. Very often there will be the neurological pathologies also, like tremors or the other physical assets. Intellectual capacities also will be reduced. That will be even dementia. Adhaprashosi shastangah sambrishta purushachhavihi prasupta gatra avayavah shushka klomagalanaha. Adhaprashosi is a cachectic changes produced due to excess of walking or maybe other activities. There would be physical abnormalities. His organs, like peripheral organs like joints, they would not be able to bear the weight, and the physical appearance would be somewhat rough or weak appearance, and the whole body seems to be numb. Patient would have a weak numb. Shushka klomagalanaha, that he will have excess of thirst, and hence his throat will be dry. And kloma, again controversial whether it is pancreas or other way. Anyway, there would be a excess of thirst acid because the kloma is involved. व्यायामशोषी भूयिष्ठम एभिरेव समन्वितः उरक्षरकृतिलिङ्गैः संयुक्तश्चक्षुराद्विना. A shosha produced or cachexia produced due to other regular heavy physical activity also would have the similar clinical symptoms of ardhashoshi. Along with that, the patient may have a chest pain or the features of urakshara, cough and hematemesis also can occur. रक्तक्षयात् वेदनाभिः तथैव आहारयन्त्रात् व्रणितस्य भवेत् शोषः स च असाध्यतमः स्मृतः. A patient who has a chronic wound which is not healing, a non-healing ulcer, in due course of time can result in a emaciating disorder. That wound healing emaciation is a well-known entity. You will see it in plenty of patients, and in such conditions due to the pain or due to a regulation of the food, the patient would have developed the cachexia according to Sushruta. Of course, now we know that inflammatory mediators like interleukins are the responsible for the cachectic changes, and it is quite seen in case of chronic osteomyelitis, and that's why in many of the osteomyelitis conditions, amputation is the ultimate choice of the treatment, or bronchiectasis. In such condition also, bronchiectasis, the continuous flow of interleukins itself can result in the impaired vitality. The cachectic changes could occur, and hence the lobectomy also could be the ultimate treatment. Now, so hence that Vranita patient due to the Vrana developing the Shosha is a well-established entity, and it's considered as asadhya. Vyayama bhara adhyenehi abhigata adimaitunehi karma chapi urasena bhaksho yasya vidaritam तस्य उरसि क्षते रक्तं पूय श्लेष्मा च गच्छति कासमानः छर्तये च पीतरक्त असित अरुणं सन्तप्तवक्षाः सो अत्यर्थं दुयनात् परिताम्यति दुर्गन्धवदनोच्छ्वासः पीनवर्णस्वरो नरः. Urakshata is a respiratory disorders. patients who have a respiratory disorders, and respiratory disorders could be induced due to excess of physical activity, carrying heavy weight, or adhyayana, not simply reading or studying. Too much of loud study would be the other causes. Abhigata, traumas, or atimechune, excess of sexual activity also can result in urakshata, and there would be a impairment of the respiratory function. Uraha vidarana, I would say, impairment of the respiratory functions, and hence the patient would have either hematemesis or maybe purulent expectoration, and there would be persistent cough, even vomiting, and vomiting also would be having multiple colors, and there would be a total abnormality in the chest. The chest would be discomfort, but there would be burning sensation, and there can be even foul smell in the breath. The voice and the appearance, physical appearance would be severely affected in such patient, and that condition is the urakshata. And urakshata could occur in any chronic lung pathology, COPDs, bronchiectasis, tuberculosis, tumors. These are the conditions which could be considered as urakshata, where we will have all these clinical symptoms together. केषाञ्चित् एवं शोषो हि कारणैः भेदमागतः न तत्र दोषलिङ्गानां समस्तानां निपातनम्. At times there could be some cases of shosha where the causes cannot be defined, and the dosha lakshanas can be seen as either only single doshas like vata lakshana or kapha lakshana may occur, or all the lakshanas may occur. Kshaya eva hi te jnayaha pratyekam dhatu samhitaha. In all these, the dhatu kshaya is the important condition. Now, as far as the current approach in the case of cachexia, when the patient of cachexic condition comes in, one of the important issues which we should never forget, irrespective of the cause for the cachexia. See, one aspect is the cause for the cachexia, which could be of any source. A cachexia, that weight loss which is seen on the surface of the body, is just a tip of iceberg. The patient tends to, a progressive cachexia tends to affect the multiple systems of the body. Now that's exactly what we consider as a dhatukshaya, maybe pratiloma and arloma, where multiple dhatus are involved, and the common symptoms which are, or common organs which are involved, could be heart, which can result in cardiac atrophy, and the cardiac muscles would be malfunctioning. The immune system, the whole phagocytotic and lymphocytic immune system would be affected. The inflammatory inflammation can result in insulin resistance. Pancreas may get affected, which can result in insulin resistance, and diabetes, either triggering of diabetes or diabetes-like conditions could occur in the clinical presentation. In the brain, the glucocorticoids would be brain results in anorexia, and glucocorticoids tend to get stimulated in the body due to hypothalamic inflammation. Bone density would be affected. In the gastrointestinal tract, the absorption mechanism would be affected, and the microbia in the microbial organisms in the intestines would be affected. Liver also can result in fatty changes, stasis of the gallbladder, this bile, and so on. So the complications which can be produced could be very significant, and they could be clinically seen as a involuntary weight loss, where the patient would have a progressive weight loss, or there could be muscle wasting, and anorexia is one of the important presentation in all cachectic patient. Functional ability would be reduced, swelling or edema could due to the protein level being reduced, or that's very typical of protein energy malnourishment. These are the other clinical signs which are seen, and of course, it's almost same as repeated, and the other clinical symptoms along with that would be patient would have very fatigue, significant fatigue, weakness, anorexia, nutritional deficiencies, or any symptoms of vitamin deficiency. Different vitamin deficiencies can occur. The loss of fat and muscle tissue leading to an appearance, typical gaunt appearance, like a typical appearance of a cachectic patient could be seen. And immune functions are affected, resulting in susceptibility to infections. Then psychologically, the patient tends to become depressed, anxiety, and so on. So the same issues are seen. Clinical description of the cachexia as described in Sushra and what we see in the contemporary situation are almost same. Chikitsitam tesham hi pravuktam dhatusamkshe. The principles of the treatment of dhatukshaya are mentioned in the previous chapters, where the dhatukshaya are discussed. But still, some of the specific portions of the treatment are Shwasa, Angasada, Kapasamsrava, Kalushosha, Chardi, Agnisada, Madapinasa, Pandunidraha, Shoshe, Bhavishyati, Bhavanti Sachapi, Jantuhu, Shuklekshano, Bhavati, Mamsaparo, Suho, Swapneshu, Kaka, Shuka, Shallaki, Neelakantha, Gridhra, Riva, Kapayas, Krakala, Sakascha, Tamwahayanti, Sahanadihi, Vijalascha, Pashet, Shushkan, Stan, Pavana Dhuma, Dabar Didanscha. A patient who tends to have chronic cough, general debility, excess of salivation, and dryness in the oral cavity, repeated vomiting, impaired digestive capacity, or chronic nasal discharges, or altered consciousness, or altered behavioral changes, who becomes pale and who gets affected by sleep. These are the Purva or prodromal symptoms of Shosha. And the Shosha patient also tends to have pallor, and he tends to have, show a preference for more non-vegetarian food. And those who have a tendency, prodromal symptoms, they also may be having some features seen in the dream. In the dream, where the birds, like crow, or the Nilakanta is peacock, and Gridhra, eagle, so or monkeys come in their dream, or in the dream when a person repeatedly sees a dry river or a dry weather in general, extremely dry weather, he also may have a possibility of developing catechic disorders in due course. Right? But these dream and other things, whether they are really true or not, or to get the history would be difficult. Whereas the other way, Mahashanam Kshiyamanam Atisara Nipidram Shunam Mushkodaram Chiva Ekshmanam Parivarjayeta. If a person consumes more food but still he has loss of weight, as in many cases of that hypervolemia, we will consider as bulimia as such, where there would be, and often related to thyroid hormone, or Atisara Nipidram, who tends to have repeated diarrhea, and who tends to have edema in the scrotum or in the abdomen. That's exactly what we see in protein energy malnourishment, PEM conditions. Such conditions are considered varjya, cannot be cured. Upachared atmantum ditagnim akrisham navam. The treatment is possible only in those patients who have good willpower and who have a moderate digestion capacity and who has not lost weight too much. The significant weight loss is not seen, and recent onset conditions can be treated. The options of the treatment are Sthiraj Varga Siddhena, Ghrtena, Ajavikena, cha, Stigdasya, Mrudu Kartavyam, Gurtham Chadhascha Shodhanam, Asthapanam Tatakaryam, Shirasascha Virecharam. Sthiraj Varga Siddha, Ghrta could be either goat's Ghrta or sheep's Ghrta, could be preferred. And with that you have to be the Snedana, and then Shodhana, Vamana and Virechana has to be done, and Asthapana also has to be done. Shiro Virechana also is to be suggested. All forms of the Shodhana have to be suggested. Yava Godhuma Shalinuscha Rasai Bhunjita Shodhita. After the Shodhana, you should give nourishing food with the Yava Godhuma, that all high protein containing diets, or Shali, the rice also, where comparatively protein less is lesser, but with the Mamsarasa, it has to be given. Dre Agno Brumhechapi Nivratta Upadronaram. Once the patient has a proper digestive capacity, Brahmana Aushadis, Brahmana therapy has to be followed. Vyavaya Shoshanam Prayo Bhajante Vatajagadaha Brahmaniya Vidistasme Hitaha Snigtho Anilapaha. In Vyavaya Shoshi, that's the Pratilomakshaya produced due to sexual activity, he tends to have more of Vataja Vyati, and hence the all Vatahara Brahmana Chikitsa has to be followed. Kakan, Ulukan, Nakulan, Bidalan, Dandupadan, Vyala Videshaya Akhun, Gurdhamsha Vidyat Vividhi Pravavihi, Sasaindavan Sarshapatail Bhristana, Deyani Mamsani Jangalani, Mugga Adaki, Super Asashta Sadhyaha, Khara, Ustra, Naga, Ashwatara, Ashwajani, Deyani Mamsani Sukalpitani, Mamsopadamshascha, Pibet Aristana, Mardika Yuktan Madirashcha Sevyaha, Arka, Amrita, Kshara, Jaloshitebhyaha, कृत्वा यवेभ्यः विविधांश्च भक्ष्यान् खादेत् पिबेत् सर्पिः अजाविकं वा कृशो यवाग्वा सह भक्तकाले सर्पिर्मधुभ्यां त्रिकटुप्रतिश्यात् चव्या विडङ्ग उपहितं क्षयातः. The major aspect of the treatment of Shosha is food, and the food mainly Sushruta suggests about non-vegetarian options, and those non-vegetarian options are either it could be birds like kaka, uluka is owl, kaka crow as such, or nakula is mongoose, bidala cats, gandupada worms, or dileshaya rats, etc., or gridha eagle. So different sources of the non-vegetarian food processed with the Shoshapratishedha, these have to be given, or any jangala mamsa with the mutka adhaki suparasaha, the soup prepared with the green gram or this adhaki tuharda. Then the fleshes of big animals like khara, donkey, ustra, even camel, naga, elephant, or even horse, their flesh could be given. And the flesh, non-vegetarian food, that flesh has to be eaten with the wine or maybe other alcoholic preparations. Then yaba, or the dhanya, the vegetarian food, it has to be processed in arka amrita kshara jala, arka jala or amrita jala, and it has to be given along with the ghee of either goats or sheep, which has to be given. Mamsada mamseshu ghritam cha siddham shoshapaham shaudra kanasametam. Mamsada mamsam is the mamsa or flesh of carnivorous animals which live on flesh. Their flesh has to be used with the ghrita, and that is with the shaudra and that honey and kada, pipari has to be given. द्राक्षा सीता माघरिका अबलेहः सक्षौद्रतैलः क्षयरोगघाती घृतेन च आजेन समाक्षिकेन तुरंगगंध तिलमाशचूर्णम्. Another of the yoga, draksha and sita is sugar candy, maghadika, pipari, the avaleha, the leha prepared of this with the kshaudra and taila has to be given, or ajagrata with the makshika, with the honey has to be given, with the ashwagandha and tila mashachurna. Sita ashwagandha magadodbhavanam churnam bhusak shaudraitam pralihat. One of the other option, ashwagandha churna. क्षीर विभेद्वापि तथा वाजिगंधा विपक्वम एवं लभते अंगपुष्टिम तदुत्थितं क्षीरघृतं सिताढ्यं प्रातः पिबेद्वापि पयोनुपानम् उत्सादने चापि तुरंगगंधा योज्या यवाश्चैव पुनर्नवे च. The other yoga again, ashwagandha is the major issue, along with the क्षीरा घृता or so on with the milk. कृष्णे वृषे तत्कुसुमेश्च सिद्धं सर्पिः पिबेत् क्षौदयितं हिताशि यक्ष्माणमेतत् प्रबलं च कासं श्वासं हन्यादपि पाण्डुतञ्च. वृषा is vatsaka, and the flowers of vatsaka, adatodavasika, with the ghrita and honey has to be given, and this is one of the treatment for cough and breathlessness with the anemia in case of this cachexia. शक्रद्रसाः गो अश्वगज व्यजारां क्वाथाः मिताश्चापि यथेत्तदेव भागैः मूर्वा हरिद्रा खगिरद्रुमाणां क्षीरस्य भागास्तु अपरे घृतस्य भागान् दशैतान् विभजेत् विधिज्ञः दत्त्वा त्रिवर्गं मधुरं च कृष्णं कटुत्रिकं चैव सुभद्रदारो घृतोत्तमं यक्ष्मनिवारणाय. One more of the yoga where the juices of feces, dungs, cow dung and the dungs of horse or elephant or even goats feces, and their juice is taken and processed with the different drugs like murva, haridra, etc., and it has to be given. द्वे पंचमूल्यो वरुणं करंजं भलातकं बिल्व पुनर्नवे च यवान् कुलत्थान् बलराणि भार्गी पाठां हुताशं समही कदम्बं कृत्वा कषायं विपचेद्दितस्य षड्भिः पात्रैः घृतपात्रमेकं व्योषं महावृक्षपयो अभयां च चव्यं सुराख्यं लवणोत्तमं च एतद्धि शोषं जठराणि चैव हन्यात् प्रमेहांश्च सह अनिलेन. One more of the ghrita preparation where dashamula and varuna etc. has to be used. Go ashwa avi aja ibha yena khara usra jatihi shakar drasa kshira rasakshatotthihi द्राक्षा अश्वगंधा मगधासिताभिः सिद्धं घृतं यस्म विकारहारी. Another of the yoga where the fecal materials of different animals are used along with the draksha, ashwagandha, etc. Yela, Ajamoda, Amalaka, Abhaya, Aksha Gayatri, Parishtasana, Sharasarana, Bidanga, Ballataka, Chitraka, Ugra, Katutrika, Amboda, Surasramcha, Paktva, Dele, Tena, Pachiddi Sarpi, Tasmin Susithe to Avatariteja. त्रिंशत् फलानि अत्र सिसोफलायाः दत्त्वा तुगा क्षीरफलानि षट् च प्रस्थे घृतस्य द्विगुणं च दद्यात् क्षौद्रं ततो मन्तः तं विदध्यात् फलं फलं प्रातरथक् प्रलिश्य पश्चात् पिबेत् क्षीरम् अतन्त्रितश्च एतद्धि मेध्यं परमं पवित्रं चक्षुष्यम् आयुष्यम् अथो वेशस्यं यक्ष्माणमाशु विपहन्ति चैतत् पाण्डवामेमतीव भुगन्धरं च श्वासं च हन्ति स्वरभेदकासा हृत्प्रीह गुल्मग्रहणी गदाश्च न चात्र कञ्चित् परिवर्जनीयं रसायनं चैतद् उपास्यमानं. रसायन yoga where the preparation, the drugs used are elaja, etc. Lots heat is given and it has to be prepared in the ghrutapaka and has to be taken one pala every day. Prihodaroktam vihitancha sarvihi triniyeva chanyani hitani chatra. All the other Dhrita yogas which are mentioned in the Prihodara context also are useful, and this Rasayana Aushadhi can be used in many other disease conditions. Upadravamsya Saravekritadim Jayed Yathaswam Prasamiksha Shastram. When there are some symptoms of Saravekrita, etc., it has to be symptomatic treatment based upon the references of these in different chapters. Ajashakrita Mutra Payoghruta Asruk Mamsalayani Pratisevamanaha Snanadi Nana Bhijanadihati Masad Ashesham Niyamena Shosham. Those who consume Ajashakrita, feces of the goat, goat's urine, milk, and ghrita and rakta, blood. So the wholesale of the goats consumed every day, and the other protocols of the regular exercise, etc. If you follow it for 1 month, Shosha can be corrected. Rasavana yogam vijivat kshayartaha kshirena va nagabala prayogam सेवेत वा मागधिका विधानं तथा उपयोगं यत्न अश्मजस्य शोकं स्त्रियं क्रोधं असूयनं च त्यजेत् उदारान् विषयान् भजेत् वैद्यान् विजातीन् त्रिदशान् गुरुंश्च वाचश्च पुण्याः शृणुयात् द्विजेभ्यः. The other rasayana yogas like rasavana, garlic rasayana, or nagabala rasayana, or pipali rasayana, which can be used, or ashmandaka rasayana also has to be, can be used. And during this you have to avoid sexual indulgence. A lot of psychological disturbances have to be avoided and should be in an auspicious condition. With this, the Shosha chapter is over. It is Sushruta Samhita Mudra Tantram today. Kayachikitsa Mantra Tritiyodyaya Hadita Ekatatarimshodhyaya. If there are any questions, we will try to answer and then mind. Right, there are no questions.